Welcome to Physician Heal Thyself, the podcast, empowering you to take a whole person approach to your well-being, spirit, soul, and body. Join me, your host, Dr. Lara, naturopathic doctor, entrepreneur, and a servant of Jesus Christ. We are not just a body, we are spirit and soul. It's time to integrate medicine and spirituality into our healing. Let's get started. Welcome back to Physician Heal Thyself, the podcast. Today, I want to make sure that, first of all, whether you're listening to this or seeing it on YouTube or any other channel that you're listening to, I want to make sure that you like this, that you share it, and you subscribe to the channel so that we can reach a larger audience. Today's conversation is one that I commonly see and experience in my clinic. And we're going to talk today about hormone myths and mistakes, specifically what every woman should know, because these are the top mistakes that they are making as it relates to their hormones. Now, before I go into the conversation on hormones and the mistakes that women are making, I also want to speak to the men listening to this, because I want you to listen to this conversation, because either you're married or you will be married or you have daughters. You have women in your life that are impacted by this very thing. And I really feel it's important for you to understand what's going on with women, and also to be encouraging and supportive of the lifestyle behaviors and habits to encourage them to do better for themselves. It's really important because oftentimes men, think that their wives are going crazy, that all of a sudden they're being lazy, and they're emotionally unstable. They look like they're being psychotic, and that's most likely true, but it's because of the hormones that's impacting them to feel in such a way. So what can we do about it, right? I also want to talk about how right now there is so much hype and talk about hormones, about perimenopause, about menopause, right? And there's so many sources of information out there, some of them credible and many are not. And I want to caution you in regards to what sources of information you're getting these facts, right? TikTok is one of those that is just very trendy to talk about these things. So it's not uncommon that men and women will see a short TikTok on hormones or hormone therapy, something as it relates to health, and they take it as a fact. And there's so much information right now, right? We're in the age of information. There's so much information at our fingertips 24/7. And it's sometimes hard to discern what's credible, what's true, what's not true, what's applicable to you, and what's not. And so I really want to caution you, because even if it's, for example, if it's a scientist talking about hormones and research or physical activity, whatever it is, they're researchers. They're not physicians. And there is a difference between someone who's doing research and someone who's in a clinical setting seeing patients as it relates to certain topics, right? And so I am a practicing physician, and I do look at the research, and there are some things that are true that we can say, yes, I do see that in my patients. But there's so many variables that we need to take into consideration. And it is the physician's job, whether it's a naturopathic medical doctor like myself or a medical doctor or an osteopathic doctor. The role of the physician is to get to know their patient, to ask the right questions and dig deep down to get the information as it relates to their patient, develop a relationship where the patient's being heard, they're being respected, and then they're given the appropriate labs to assess, and also the appropriate solutions, right, to address their concerns. And I know that's very involved, and I know not every doctor works that way, but that is truly the art of medicine, and that is what a physician should do. It's to develop this kind of relationship, to get to know their patient, so that we can make informed decisions and give them the best choices, going over the pros and the cons, the risk and the benefits, and all their options that they have. That's the ideal. So when we look at what the internet has to share and talk about, there's a lot of information. And I just want to say for you to be cautious, because I get a lot of women in my office and men as well that are always, they may be addressing a video they saw on social media, and they're asking me about that. And so we're going to talk about these common myths and common mistakes that women make. So let's go ahead and get started. So we know that hormones, they matter. They matter not just when you're going through menopause. They matter from the beginning when you start going through puberty. And unfortunately, we don't have enough people that are truly, fully educating, the common person to understand how their body works. And I did a previous episode on hormones. I'll make sure I include it in the notes to this episode, but this one's going to be a little bit different. We're going to talk about just the common mistakes that people are making and why they end up in hormone imbalances. So we know that hormones have a huge impact on how we feel. It impacts our energy. It impacts our mood. It impacts our sleep, our weight, and even how we handle stress in our life. So it's not uncommon that I get women in my office, right? And they don't feel well. They say they feel off. They don't feel like themselves. And it happened all of a sudden. However, that all of a sudden is an accumulation of years of behaviors that that person has done that has led them to this point of feeling off. So women are not sure where to go and where to get information. So I understand that they turn to, Google, and they turn to social media and YouTube to find out about this. And while there's a lot of good information, there's almost like too much information. And some people say to do one thing, and someone else will knock that one option to say, that's not good, don't do that. So I'm going to tell you right now that the common trap that people get into is that they start diagnosing themselves by using the internet. And it's very difficult for you as an individual to determine what you need because you're not trained to look for all of these different areas. So as we talk about, hormones, I want to talk about some of the common myths that I see or I hear about when it comes to hormones. So myth number 1, hormones only matter during menopause. Well, not true. The problem is that women wait till they're going through menopause, right? Where their cycles are making less hormones. So they're not having a menstrual period every month, or they're skipping it, or there's just irregularities. And this tends to happen for some women in their mid 40s to, early 50s is when women will start to experience this. But it doesn't just matter when you're going through menopause. You should be worried about hormones from the time you're going through puberty, as a teenager, as a young woman in their 20s. And so hormones are always going to be working for you or against you. So you really need to, early on, take the precautions and take the right measures to ensure that you have optimal hormonal health. So these hormones like estrogen and progesterone are the hormones that women just thrive in. Like that's what makes us feel really good. It's not just about reproduction either, right? Yes, if you want to get pregnant, these hormones are key players in getting pregnant and maintaining a healthy pregnancy. However, it's also going to have a huge impact on your mental health, your emotional health, and your physical well-being. So very important. But also hormones like testosterone, insulin, cortisol, thyroid hormones, those are also hormones to take into consideration that, if they're low, they can really start to mimic the other hormones that may be low as well. And like I said, these hormones impact your energy, your mood, your metabolism, and so much more. So younger women can absolutely have hormone imbalances. And it's not just for women when they're in menopause. So you really want to worry about hormones early on and take, preventative measures to make sure that you're having healthy hormones. Myth number 2, birth control fixes hormone imbalances. Well, that's a lie. Birth control does not manage, while it manages symptoms, it doesn't fix the root cause. And so I see this happen in teenage girls and young women where they're just given a birth control and in hopes that it's going to help their hormone imbalances, but it doesn't really help. It's just masking symptoms. I see this in women with PCOS or endometriosis. And like I said, we really need to dig deeper down what's causing these hormone imbalances. And we're going to talk about that. So just hold on to that for a moment. But birth control, make an informed choice. There's a time and place for it, but it's not going to fix your hormone imbalance. It's actually going to create more hormone imbalance, especially in the long run. Myth number 3 is if my labs are normal, my hormones are fine. And I'm just going to pause right there and say, when your doctor says my labs are normal, you as an individual might not know what are the labs that are important for me to have my doctor check. And then also for women, what time of the month are they checking these hormones, especially as we're talking about sex female hormones. Women menstruate. They have a menstrual cycle, and every week of the month, hormones fluctuate for women. Now, in men, they have the same hormones. They don't really have much fluctuation throughout a month. But for women have what I call the 4 seasons in the month. The same way that we experience spring and summer and fall and winter, women experience that in a month's time. So men, listen, if you see different aspects of your wife throughout the month, it's because she's going through all 4 seasons in every week. So spring could be right after a woman's period. She feels refreshed and she feels energized and happy. And then the summer comes along, and that's that second week when they're in that, ovulation phase, and they feel really good and energized and great. And a little bit extending into the luteal phase, they start to still feel good in summer, but as the hormones drop, they start to go through the fall season. They might have less energy, just mood-wise they're off. And then during the menstrual period, when they're actually having a period, this is their winter time. They're tired. They might not feel like going out. Their mood is off. They might feel a little down. And so that's kind of the average of what you see. But I'll tell you this, in a healthy female whose hormones are regulated, they won't really feel much of a difference from one week to another. If anything, they'll notice a difference in muscle strength and maybe energy. But mood-wise, if they're healthy, they're eating well, they're doing all the right things, they're not going to feel much of a difference. So I want to address this myth 3. If my labs are normal, then your hormones are fine. Well, first and foremost, most primary care doctors or even OBGYN doctors are not doing labs to check your hormones. They don't believe it's an issue. And so if they're not checking hormones, then what is coming back normal? What are they actually testing? When I do get patients that tell me that their doctor or their OBGYN doctor checked hormones, it's usually not sufficient. It's a couple hormones, and then they're not checking them at the right time of the month. You want to check it during the luteal phase, which are days 19 through 21 of your menstrual cycle. And just so you know, day 1 is the first day that you start your period. So you would count 19 to 21 days from there to identify, are your progesterone and estrogen levels where they need to be during this peak time. And so most of the time, if they're doing them, they say they're normal. They're not doing the right labs, and they're not doing them during the right time of the month. So when women are told that everything's normal, but they still feel off, they didn't really check. Because I'll tell you, 10 out of 10 times when women start telling me their symptoms and how they feel, I already know they have low progesterone, definitely. And I know that they're low in estrogen, so it may be low in cortisol. So I know what tests to do based on what they're telling me. So you definitely want to look at working with someone who's looking at functional ranges of labs and not just clinical ranges, and doing the test at the right time. So we're going to talk now about, and there's a lot more myths, of course, that we can go through, but I really want to focus in on the common mistakes that I see in my clinic. And I know that other practicing physicians that practice similar to me are going to agree with what I say. When I get a female that's coming in and they're complaining, not complaining like, whiny complain, but their concerns, their chief concerns are, I don't feel like myself. I feel like I'm losing my mind. I have tons of anxiety and panic attacks, and I never had those before. I cannot fall asleep and I cannot stay asleep. I have no energy. I'm falling asleep throughout the day. So they can't wake up in the morning with energy. They're dragging throughout the day. And then at night, they can't fall asleep, right? They're having palpitations. Sometimes these are very odd symptoms that are not very commonly talked about, but they'll have a sensitivity in their scalp. All of a sudden, they notice a sensitivity in their scalp, and that's a sign of low estrogen. So estrogen has this neurogenic effect on us, and it starts to affect the nervous system. And so they have this sensitivity to their scalp. They can also have headaches. Like in their forehead or the top of their head, they'll have headaches. And I mean, the symptoms go on and on: vaginal dryness, low sex drive. Just their memory concentration is out the door. So there's a lot of symptoms that present, and I know this is a hormone imbalance. So we do the right test and we confirm it. But when I go through an assessment with a new patient, I immediately ask, tell me, what are you eating? And start from the beginning of the day. Are you having breakfast? I would say that 9 out of 10 people, including men, are saying they're not having breakfast. They're skipping breakfast. And the common thing I hear is, well, I'm just not hungry when I wake up. And the truth is, no one is hungry when they wake up, because cortisol, it's high in the morning because that's what wakes us up. I say cortisol, it's our internal alarm clock. It wakes us up. And once that is up, it puts out insulin, it puts out a little bit of glucose, so you have energy to get started in your day. But about 2 to 3 hours after the time that you wake up, these cortisol levels start to come down a little bit, and that's when we should eat. So you should be eating 2 to 3 hours after you wake up. Unfortunately, what I see a lot is they're skipping breakfast and they're getting to lunch maybe between 12 and 2 o'clock. Most women are having their first meal. So just think about this. The common female that's a mom, they're married, they're working. They get up, they're getting kids ready to go to school and dropping them off and then getting themselves to work. And so you start your day busy, running without having to eat. You haven't ate anything, so your tank is kind of empty from the night before when you had your last meal. So skipping this breakfast part, it's critical, and I see that this happens a lot. And I once again, the social media. Thank you, social media gods, for infesting the minds of humans to think that everybody needs to be intermittent fasting, and I highly disagree with that. These type of situations need to be looked at on an individual basis. I don't care what the research says. If it doesn't work for you, don't do it. You know how many men and women I've had in my office? They look healthy, they look fit, they're eating healthy foods, they're not eating high carb, refined sugars, or not eating processed foods, and they're exercising and they look very healthy. On paper and in person, they look fine. But when I run their test and I looked at insulin, fasting insulin levels, and I look at C-peptide levels, which is what the pancreas is doing, and I look at hemoglobin A1C, and I look at the glucose levels that morning, what I commonly find is that they're either pre-diabetic or they're insulin resistant or full-blown diabetic. I mean, I've had men in my office that are intermittent fasting and they feel good. They're doing good with their diet and exercise. But the labs show man, you're pre-diabetic and you're insulin resistant. So this kind of way of dieting or eating or lifestyle, however you want to refer to it, it doesn't work for them. It doesn't work for everyone. And the word in itself, intermittent fasting, you're not supposed to do this for the rest of your life every day. It doesn't work. And I've heard many debates on this the caveman days, people were hunting and they didn't eat breakfast, lunch, and dinner. That's more modern. Yeah, these people were also moving a lot and they had a different lifestyle. They were in the sun. They didn't have all the modern things that we do. So we have to adapt to how our lifestyle is. And that's going to really vary from person to person. I am not a fan of intermittent fasting. I use my brain a lot. I consult with patients. I need fuel in my body. My brain needs fuel to function. And I start off with ensuring that I have the right amount of protein and some healthy fat in there, and let's get going. Because eventually the body will start to demand these things. It's just that we ignore our bodies most of the time. So what I recommend with, like I said, women are not eating enough, they're skipping meals. And sometimes they think they're doing this because they want to watch their weight. And that's not the way to lose fat. That's not the way to manage your weight. Eat the right foods and your body's not going to go into starvation mode and then hold on to every carb and every, calorie that you eat. It's not going to save it up. So what I commonly see is that, because I want you to remember from our last conversation on hormones, is that in order to make these hormones like estrogen and progesterone and DHEA and all of that good stuff, all of the sex hormones, including testosterone, they all come and are metabolized from cholesterol. So cholesterol, which is, healthy fats, right? When we're talking about omega-3s, everything is made from cholesterol. And it's from cholesterol that, it starts to make the hormones. So cholesterol enters the cells in the ovaries in women, and for men, it's in the testicles. And it also, from our adrenal glands, we make some hormones there as well. So as cholesterol enters the cells of the ovaries in women, inside the cell, cholesterol is going to transport that into the mitochondria, which is your powerhouse of the cells. And in this mitochondria, there's an enzyme called P450 SCC. So this enzyme is what's going to cleave cholesterol. It's going to break it down into a smaller form, and it's going to make a hormone called pregnenolone. Pregnenolone is known as the mother hormone, and this is true for both men and women. And from here is where we make all of the other hormones like DHEA, testosterone, estradiol, estrone, progesterone, cortisol, all made from cholesterol to pregnenolone. Most of the doctors are not checking pregnenolone. So if that bucket is empty, it cannot make the other hormones. And doctors are just looking at testosterone in men and estrogen and progesterone in women. And that's not sufficient blood work, which is why I said, if the labs are normal, what are we referring to as being normal? Did they do the full panel? So we do the full panel as naturopaths. We look at pregnenolone and every other hormone that falls under that cascade. So nutrition is really important. If women are not eating enough, they're not getting all the nutrients and all the things that are the building blocks to making these hormones, no matter what you do, you're not going to be able to make them and you're going to be deficient. So I tell women to aim for, fats anywhere from 44 to 78 grams of fat a day in divided doses, obviously. And then protein-wise, you should be eating about a gram of protein per pound. If you're 180 pounds, you're not going to eat 180 grams of protein. Most women aren't even eating 60 grams of protein a day. It's really interesting when I take into account a day of what they're eating, they're not even getting close to 50 grams of protein. So it's like, no wonder why you feel tired and, you can't remember anything, is you don't have the energy for the output of what you're trying to get done here. So I say aim for 90 grams of protein to start with, work your way up to 120 grams of protein a day, and divide those into 3 to 4 meals, in the day. And don't skip breakfast. You can delay it, a little bit in the morning, but get in there. So the other thing as it relates to nutrition is that a lot of women will say, well, I'm just not hungry, And the thing is that our body will adapt to whatever lifestyle and behavior you have. So if you haven't been eating breakfast for years, of course you're not going to be hungry. Your body adapted to that. So you have to start introducing food, and then your body will adapt to having that food. Unless you have digestive issues, I really encourage that you look into what your digestive issues are, because people who have digestive issues are going to have hormone issues, are going to have mental health issues, are going to have many other health issues, because the gut is the first place that food arrives and gets metabolized, and it's absorbed and integrated into the body to be utilized to do what it needs to do, right? So you got to address the gut issues if those are there. So nutrition, nutrition, nutrition. You can do all the hormone replacement therapy. It's still not going to fix the root cause if you're not eating well. You still need to get fueled up. So the second mistake, common mistake that I see women do, is not sleeping enough, not sleeping the right hours either. So I get it. You know, women have a lot of interrupted sleep, whether it's menstrual cycle, pregnancies, and then even after that, you know, raising children. Sleep gets disturbed a lot, and then they create this pattern, unhealthy pattern of depriving themselves of sleep or staying up. I get this a lot from women where they say, you know, the kids are in bed, everyone's asleep, and I just need a few hours to myself. And they do this at night when everyone's asleep. I highly discourage that, because the studies show that the optimal time for women to be asleep, and men as well, anyone, is between the hours of 9 and 10. You should be asleep by that time, because this is when we get the largest surge of growth hormone, melatonin, and other hormones is during 9 and 10 o'clock. So if you're going to bed at 12 at night, 1 in the morning, you're missing that surge of hormones. And when you do this day after day after day for years, it starts to wear on you. And women, the studies show that for women, in order to have optimal hormones, you need to be sleeping between 8 and 9 hours. And like I said, be in bed, be asleep at least no later than 10, but really before 10 p.m. In men, the studies show that as long as they sleep 6 hours, their testosterone levels are not affected. But anything under 6 hours for men, you start to see hormones come down in them as well. So men can sleep less and women can't. So don't feel bad about sleeping. I really encourage that you start to change your mindset about sleep and improve the quality of your sleep. Getting into bed earlier, trying to stay asleep. I know when you have children, it's very different. Your brains are they're scanning to see what your child is doing, if they're okay and safe. But sleep is has a huge impact on our hormones. We need time to recover, to regenerate, and for the body to make these hormones while we rest. The third common mistake that I see, and you know, these are hard. I mean, it's stress, and it's chronic stress. Sometimes in life, you just have to pick your battles, and you have to start, reducing activities that are just not really that important. And women are great at creating stressors in their life that are not really important. Let me just give you an example. In the wintertime, as we enter the holidays, right, October, November, December, the body really likes to move along with the seasons as we change. So in the wintertime, we're designed to slow down and, just enjoy life during this slowdown. But this season is usually the busiest for most people. And women get carried away. I mean, God bless your hearts. I don't consider myself part of that group, because I've learned my lesson that I am not going to stress about holiday decorations and all the gifts and all the wrappings and all these things. It doesn't really matter. If I am stressing, it's going to rob me of my joy, then it's not really joyful for me. Now, if you're able to manage those situations without causing excessive stress to you, and you do find joy in that, then do that. That's your personality. That's your desire. You find joy. It's fun for you. You should do it. But unfortunately, I see a lot of women that overly stress themselves during this time of the year, and they're forcing themselves to interact with either family that there's issues there and they don't really care to interact with. And that kind of a stress is a huge impact on their hormones. And so why am I talking about stress as it relates to hormones is because when our bodies are making higher levels of cortisol, which is a stress hormone that the body will release during stressful situations, that high level of cortisol during any period of time, it's going to start to steal from progesterone, from pregnenolone, from DHEA, from testosterone, from estrogen, but primarily from pregnenolone. And pregnenolone is a hormone that, aside from, maintaining a pregnancy, it does so much more. It helps our nervous system, our brain to be calm, to be able to navigate stressful situations. It helps us with sleep. So it helps our heart to be at a good resting heart rate. So when we are depleted in progesterone, you're crazy. You're stressed out, you have anxiety, you can experience panic attacks as it relates to very low levels of progesterone. And oftentimes women go to the doctor and they say, I'm having anxiety, I'm having panic attacks. And they're like, here, have some medications for your anxiety and panic. And what they actually need is they need to get their hormones checked and they need to do the lifestyle modifications so their progesterone levels can come up naturally. So chronic stress is always going to deplete us from our hormones, especially it's chronic, right? A little stressors here and there, not a big deal. But if there's big stressors in your life that you're not facing, I suggest getting counseling. I suggest, like I said, cutting back on things that are not really a priority and just prioritize your life a little bit different. Pick your battles. The fourth mistake that I see women make, and this could be one direction or another, but usually more often than not is that women are not exercising. So they're losing a lot of muscle mass. And ladies, as you get older, you do not want to lose muscle. You don't. You want to retain muscle. You want to build muscle because there's a lot of longevity and anti-aging benefits, a huge benefit to your nervous system that you want to exercise. But more often, women are not exercising because they're busy with life and family and so forth. But in a small population of women, I also see women that are over-exercising. They're over-exercising and their nutrition plan does not match their physical activity. So the good thing about exercise is that it's great in many ways. It helps your hormone production, but you also need to have the building blocks to make those hormones. And so some women get into this, I want to lose fat. And they're lifting weights, and your muscles need food to build those muscles, to regenerate, to recover those muscles so you can work them out again. So you want to make sure that you're getting enough protein and healthy fats, a good amount of healthy carbohydrates as you're working out as well. And listen to your body, right? So there's these two extremes of some women are not exercising and some women are over-exercising, and their nutrition plan and also their sleep patterns do not align with the physical activity that they have. Look, I weight train almost every day or have some kind of physical activity every day. Now, I modify the activity from one day to a couple days later to give myself time for my muscles to heal before I go back and work out that same muscle group. But my meals have to match my physical activity. And for those women that are lifting weights, you'll notice that when you don't have enough protein that day or the day before, you cannot lift as much. Now here's the other thing too. This is very interesting. This is what makes us different than men too, is if you are a menstruating female, that your strength is going to vary throughout the month. So usually during ovulation and luteal phase, we tend to be stronger so we can use this time to lift heavier. But if you notice the week before your period or during your period, you're like, I can't lift the same weight that I did a week ago. Why not? It's because these hormones are not there. That's really it. So instead of beating yourself up over it, just modify your activity do lower weight, maybe higher rep count. What you can do during that 2-week period of not being able to lift as heavy is to really maximize on endurance activities, because women's endurance will be greater during that time versus the times that they have greater strength. And the benefit of women with higher levels in estrogen than men is that estrogen helps muscle to recover faster. So during, like I said, that ovulation and luteal phase, it's about a 2.5 week period. You can really work out your muscles every 2 days. If you're eating well and you're sleeping well and you're hydrating yourself well, you can really work the same muscle group every 2 days, because your recovery time is much, much faster than any other time of the month. So maximize on that. So those are 4 points that I brought up on mistakes: the nutrition, not sleeping right, excessive stress, either not exercising or over exercising. And there's a bonus one I want to throw in here. Those of you that are my patients, you know this about me, and I talk about it all the time. I talk about it to my friends. I talk about it to family. I talk about it to everyone. I want to talk about it to people at the gym, because they're probably the ones that annoy me the most when it comes to this one thing. And that one thing is the use of perfumes, colognes, and fragrances, and all of these chemicals that you spray on yourself or put on your body. These are huge hormone disruptors, and it also has a huge impact on nervous system regulation. I know you want to smell good, but most of the time, these things that you're using are disrupting your hormones. And there's so many stories in my clinic of situations where I've seen women doing the right things. We got the diet right, the sleep is fine, all of these other things are being managed, great supplementation that they're taking, and they're seeing some improvements, but they're still having irregular periods. And by irregular, let me just be very blunt here, what I mean by that. When a woman tells me they're having a period for 45 days, actively bleeding for 45 days, that is not normal. Or a woman has a period and it's lasting for 2 weeks, that is not normal. A woman who has a period for a week, has a week or two off, and then starts her period again, that is not normal. Being debilitated by the symptoms of hormone imbalances during a period, that is not normal. A normal period, I know some of you might disagree with this because you haven't experienced this, but for women who are healthy and are well regulated, a menstrual period is really non-eventful. You won't have much symptoms. You won't even feel it coming on. No bloating, no abdominal pain, no cramping, no headaches. It just starts and you feel fine and you can go about your activity. Unfortunately, that's not most of Americans. It's just not. Most of the women in my office have never had such an experience as that. Like, they don't know what normal is, right? But these chemicals that we're spraying and putting on our bodies, they are causing a hormone imbalance in you. And I have many times have told women in my office, they come in my office, they're sitting across from me, and I could taste their perfume in my mouth. That's how much they're wearing, or whatever fragrances they have. And when they leave my office is still smelling like that perfume, and they left it everywhere. It's lingering. So not only is it impacting them, it's impacting everyone else that's around them that's smelling this, whether it's a man or woman. And so this is why I hate that at gyms, people just drowse themselves in perfume and cologne, and you're breathing heavily during this time because you're working out and you're inhaling all of these fragrances that are also being hormone disruptors to you, even if you don't use them. So when I tell these women, I need you to clean up your environment, meaning get rid of all these fragrances, what you're personally using on yourself or spraying on yourself. I want you to change the type of cleaners that you're using in your home, for laundry, for cleaning the house, the dishes, all of that. And when they clean out their environment from these chemicals, guess what? They come back a month later and they're like, I can't believe by just removing those chemicals, my menstrual period, the menstrual period, it's better. The symptoms are diminished, they're gone. And every month that they continue to just remove those chemicals, they regulate their hormones. So I don't need the research to prove that this is true. I see it. It's as evidence in my patients and in myself because I practice these things. I don't use these chemicals. And so I'm not saying this to brag, but I know what a healthy period is. And it should not be, it should not interrupt your life. But unfortunately, it does for many women. And my goal, because I want to help women to feel better, is to help you understand that if you're not going to go to a doctor and do all those things, then at least follow these things right here for free. Like, I'm not telling you to do them. Like, this is just educational purposes. I don't know your history and all of that. But these are things that are just common sense that anyone can just think through. Oh yeah, I should eat more. I should start with my breakfast, my lunch, and my dinner, get more protein, healthy fats. Let's start there. Find out what works for you. I'm not telling you specifically what to eat, how much to eat, but figure that out for yourself, Make sure you're sleeping. Make sure you're managing stress. Get moving. Your body was moved to design to move. And get rid of these chemicals in your life that are hormone disruptors. And just by doing those 5 things, just watch every month. Be consistent with it. That's the thing. Give yourself a month. Be consistent with it every day. And you're going to see the difference in your menstrual period. The hormones will regulate just by doing these things. So I am not a fan of throwing hormone replacement therapy for all women. There is a time and place for it. And I know when the time and place for it is, because when women are not functional and their hormone tanks are all empty, then I do recommend, let's get you on some hormone replacement therapy so you can sleep better, so you're not stressed and have all the anxiety, and you're feeling better to make better decisions, right, on nutrition and sleep and exercise and managing stress. So there's a time and place for it. But if someone comes in and they're 33 years old, I'm not going to give you hormone replacement therapy, because now we're making your body be lazy in producing those hormones that it should be doing on its own. And we haven't really addressed the root cause. Giving you hormone replacement therapy, it's not fixing the problem, because the problem is it's in your behavior and your decision making. And ladies, please don't misunderstand my tone and what I'm saying. I'm very passionate. I'm very fiery. And I mean this from a really good place in my heart, because I see so many women suffering and struggling through something that they're causing themselves to go through. Now, this is not for everyone, because there's women with true situations like PCOS and endometriosis, and those are much deeper, they're much greater conditions that are causing imbalances that need further help and assistance. But for the majority of women, whether they're in their 20s, 30s, or 40s, oftentimes it's your day-to-day decisions and behavior that you have with food, sleep, stress, physical activity, and all the chemicals that you're putting onto your body. So those are the common things that I see. And I'm so tired of hearing all these, conversations on social media about hormones and perimenopause, but no one's really talking about what to do. I don't want you to get on herbs or hormone replacement therapies. What you really need is change your diet, eat more, start eating real food, start your morning with having breakfast. Coffee and a piece of toast is not breakfast. It's not. And so somebody needs to shake you up and wake you up and tell you the facts. And the facts are that if you're not eating enough and you're not sleeping the right times, just those 2 things by themselves are going to create a hormone imbalance. So you have no business looking at taking estrogen, progesterone, as a hormone replacement therapy if you're 35, because I guarantee you, if you make these changes, your hormones will come back up. They just will. I've seen it time and time in my clinic. And I'm going to do another episode. The next episode, you'll want to stay in tune with this, because one of the common things that I see that's very concerning to me is the number of young girls, and let me be specific, teenagers, 20-year-olds, that are coming in with very low hormones. It is disturbing. And it's not just women. It's also young men and young teenage boys. So there's a true, epidemic here of hormone imbalance issues, and a lot of it is attributed to our lifestyle choices. You have the power in your hands to make the changes in your day-to-day to take control of not just your hormones, but your overall health. And so I pray that this message really reaches you to make some, lifestyle decisions here. There's no need for you to be suffering and struggling through life. Get to bed early. Bottom line, put your phone down, get to bed. Stop looking at all these, TikToks and videos on health, and just get to bed. Go to sleep, go to bed, rest. If you're struggling with sleep, then we need to address that. And that's the other thing, is that these things are cyclical. If you've been making poor decisions for many, many years, now your hormones are down and you can't stay asleep because you have low progesterone. Now we're having to backtrack and try to help you to get to sleep so that your body can make the hormones, right? So if this is not where you're at the moment in your life, don't wait till you get there. Just be consistent with life and understand that, sometimes life throws you curveballs. And so we have to navigate and make the best of it. But don't make yourself, or you should make yourself a priority when it comes to your physical health. Don't drive yourself to the grave too soon. And this burnout, it's not the way to live life. So, hey, I hope you've enjoyed all this information as I talked about the top things, the top common mistakes that women are making that are having such a huge impact on your hormones. And guess what? You can change all that for free. You can just start making these changes. If you need to consult with your doctor, consult with your doctor. But these are common sense things that you can do for yourself that will improve your hormone health overall. I want you to stay tuned for the next episode because like I said, I'm going to talk about the impact that I'm seeing in young women and young teenagers as it relates to their hormones. So I hope you've taken great value from this conversation. And until next time, be blessed. Thank you for listening to Physician Heal Thyself, the podcast. If you like what you've heard, please like, share, and subscribe. Help this message reach more people who may need to hear it. Leave your comments. I want to know what you think. If you're interested in learning more about Raices, visit our website at raicesndmedcenter.com. Until next time, be blessed.